today is August 29th. So it's been how long since you last updated?
2 months and 5 days.
Okay.
Or sorry, since I last updated?
Yes.
Probably a month.
Okay. But it's been 2 months and 5 days since you've had the distractor.
Installed, yep. Since I had my ease procedure.
Okay. So what has happened since you last updated? And how much expansion have you had? And how are you breathing and sleeping?
So since I last updated, which was about a month, I probably have expanded another like 5 millimeters or so. I measured, so just from before getting this operation, I set a baseline intermolar width, which is the width between the first molars, the inside edge of the first molars, so there to there, 31 millimeters. Currently, as of 2 days ago, I'm at about 38 millimeters. So pretty good expansion overall. But important to note that with this procedure, because the distractor is higher up in the palatal vault, and the forces are really trying to expand superiorly up, like higher up in the nasal cavity. Dr. Lee mentioned that the intermolar width isn't quite as important here as it would be for other expansion techniques like MSC, because you might still be getting a lot of three-dimensional expansion in the nasal cavity, but the length that you turn the distractor doesn't necessarily correspond one-to-one with the distance that you gain between the arch or in the arch.
And is the amount of expansion that you've experienced about what you had expected at this point in the process?
Yeah, I would say so. This is 7 millimeters or so in 2 months is pretty good. It's slower, but for an adult my age, I would rather take the more conservative approach and expand slower and make sure everything's settling in nicely, especially the bite. I started off with a cross bite, and that's starting to improve with the way that he installed the distractor.
Okay. And how is your breathing and your sleeping going?
So breathing is still only about 10 to 15% better from pre-op. I still can breathe through both nostrils, which is better than before, but it is still a little congested, but it's slowly improving, and it will continue to improve slowly but steadily. Sleep lags behind a little bit. I've had a few good nights, and I've had a couple nights where I'd have blocks of 3 to 4 hours of uninterrupted sleep, which for me is rare. My sleep would be interrupted every 30-45 minutes with mini wake-ups, and I track this with an Aura app. So I'm starting to see nights where I'll have 4 hours of no interruptions, which is a good sign. It's going to improve, and I think we'll have ups and downs, but on average I'm starting to see a little bit more of that. One more thing there, Aura just started tracking SpO2, which I wish that it had that before I got this procedure done so I can have a baseline, but it only came out after I got this installed. Either way, it's showing a 97 to 98% oxygen saturation throughout the night, which is good. However accurate that is for Aura, it's good.
You went to the Ancestral Health Symposium about a week or two ago. What happened while you were there? Something happened. It was fun.
So I went to the Ancestral Health Symposium mainly to find and talk to Mike Mew. I knew that he was going to do a talk there, so that's the main reason I went. So he did a panel with a couple other big names that most of you guys probably are familiar with: James Nestor, author of Breathe, a few other really good people, dentist and orthotropic orthodontist, and very good session, good discussion. But I was able to find him after the talk, and I showed him what I was doing, showed him the distractor. He was excited about just young people trying to do something to cause an upswing in their facial form, and to help spread awareness about this topic in general. So the conversation essentially was thinking of ways that I could help Mike Mew in his cause. And I think that's the most important thing for this community is, as someone who's brought this entire topic to light and has kind of pushed this orthotropics and mewing movement, um, and shed so much light on why we have sleep apnea and crooked teeth, I have this I feel indebted to give it back in some way. So he has a court case in November. We're trying to find ways to start sort of a grassroots movement of awareness around this, spread the knowledge, and also essentially cause like a face revolution, if you will. After I had a chat with him, got his number and everything, and we're gonna work together in some way, I was flagged down by a film crew, and they asked if I had a moment for questions, and they asked me a series of questions around why I attended this event, what my journey has been with jaw-related work, expansion, sleep apnea, kind of my health journey, and a couple of questions were around Mike Mew and his cause, and how that made me feel, and kind of around that. And after the interview, I asked, what's this all about? Because I had no idea. They just got me right outside the event, and they said they're filming a documentary on Mike Mew, his journey, and up until his court case in November, and that this interview could be a part of it. So that's really awesome. I think it'll shed a lot of awareness on this whole movement, and I'll put up a picture of the film crew getting a close-up of the distractor. It's a really funny shot. Yeah, so that's what happened.
Nice. So how has the experience been working with Dr. Lee remotely? You went to Palo Alto for the first few weeks so that he could manually expand you, and now you're doing it yourself and every other day, and you send pictures to him. So how has that experience been for you?
Mostly good, mostly smooth. Dr. Lee is very responsive, and he will respond quickly if you have a specific question. So I just expand, I take photos of like a shot like this, and then biting down and showing the bite. And so it's been good. Recently, there's been an interesting sort of development that I've noticed, and you guys might be able to tell. This side, the right side, has a little bit of an asymmetrical expansion going on right now. It's not too bad, and that's what I'm currently in. Just the last 2 days I noticed this, and I've been texting Dr. Lee back and forth, and he's not too concerned. Sometimes it can push on the alveolar bone if there's a lot of resistance on this side, so it can cause a little bit of lateralization of the alveolar bone, which is okay. And he said turn a little slower, and if it doesn't kind of correct itself over time, then he'll just reposition the distractor done under local anesthesia. So just go in, and he'll find another spot on this side to push against the maxilla on the right side. But even though it looks a little asymmetrical, I think he wants to focus on how has the bite improved. And I did have a cross bite on that side. So on the right side, this portion was inside the lower jaw. So the teeth were sitting like this. And he placed it in such a way intentionally to lateralize that segment as much as possible, so to correct the crossbite, which has happened. So now you can see that this side is well above and well to the right of the bottom arch. So the crossbite has improved, and now it's just a matter of sort of seeing how much that segment, the right side, continues to go to the right, and if there needs to be some repositioning, he'll take care of that. So.
Okay. And the next step of this is finding an orthodontist. So everything out and hopefully bring the maxilla forward. So what does that look like in terms of, you know, how are you sourcing the orthodontist, and what's the process been like for you so far?
It's been interesting. It's I'm starting to have conversations with some orthodontists, even though there's still a couple more months of just transverse expansion. I want to have some initial chats and consultations because this is really sort of an experimental treatment. There's not a single person who has a defined procedure for non-surgical advancement of the maxilla in an adult. It's very difficult to do, as we all know. Bone, there isn't, it's easier to split this suture in the midline and cause expansion this way because there is a suture there. There is no suture that runs parallel or perpendicular to that you can cut and cause forward movement. So the techniques so far are reverse pull headgear, like a face mask, having elastics anchored to braces on the teeth, and having that pull forward. So I'm exploring all these options and mainly bringing this up with orthodontists in the area who are willing to sort of try more experimental approaches to bringing the maxilla forward. I'm in Southern California, so I've talked to Dr. Ting, I've talked to I will talk to Dr. Waldman, and there's a few orthotropic orthodontists down here as well. Dr. Brady is one of them. So I'm sort of trying to collaborate with someone and basically say, look, I'm open to just giving this a shot. I know the results may not be really that successful, but let's get as much as we can forward. And so, yeah, I'm in the middle of that journey. If after this expansion the sleep is still problematic and I still have apnea, then I probably will end up going for an MMA at the end of this journey. If it's not as severe and my sleep has improved, then I'll probably try to do non-surgical pulling of the maxilla so that I do have proper structure, but it's not that dire because I'm sleeping okay, if that makes sense.
Yeah. And from your last several videos, you had a lot of questions about the difference between MSc and ease and the pros and cons. Did you want to address some of those?
Yeah, I guess the general theme of those questions are there are some comments asking what's best for me given my symptoms or my particular situation. And the first thing I want to clarify there is that you should definitely consult a licensed orthodontist or professional for those specific type of questions. Obviously, I'm not a medical professional, I'm just sharing my own journey, so that has to be said. Secondarily, between the MSc and the ease, that's also a very individual decision. And what I mean is that it's not necessarily the case that one is just better than the other. MSc will work great for a lot of people, especially if you have crossbite, you need just structural correction, and so I want to point that out. The reason I chose ease over MSc is because of my particular bone structure, particularly this area of the upper maxillary bone, which is this area right here. X-rays reveal that that bone for me was very thin, and as we know, the MSc installs 4 screws directly into that area, the roof of the mouth, and there was a risk of those screws not properly engaging the bone to split the maxilla apart. And what might have happened for me was that the screws would have just dragged across the surface, the roof of the mouth. And so for my particular situation, these was a better choice because the foot plates, the points of pushing are against the side of the maxilla where I had thicker bone. So that being said, do your own research and most importantly, consult a lot of orthodontists. talk to many of them and ask really good questions so that you can understand their philosophy behind expansion.
Nice. Anything else you want to say about where you are at this point in the journey? You have what, 2 months left about?
Maybe 2.5 months of expansion, and then 3 months of what's called a consolidation phase, where I just let it sit while a new bone fills in and strengthens in the middle.
Nice. So
So
everything is kind of going as you had thought up until this point, or are there any differences in your expectations versus reality?
the only difference is the little bit of asymmetrical expansion that's happening on the right side. That was unexpected, but I don't think it's a huge problem. I just think that expansion is never uniform, and the maxilla doesn't expand uniformly, especially when you're pushing higher up. So, and he's, you know, worst case scenario is that we'll reposition the bar so that it pushes on a different point. So other than that, everything's going as expected. The improvements are coming slowly, but that's also expected. I didn't expect this to be an overnight fix for my sleep. But in another 2 to 3 months, there should be a good amount of improvement in nasal breathing and subsequently sleep. So definitely we'll keep everyone posted on this journey. And sorry the update took so long this time.
We'll have another one out soon.
Yeah. Thanks, guys.
All right.